Each operation is a little bit different. You never assume anything.
Kids are naturally curious.
We ask a lot of questions.
It helps us learn.
I'm Ethan.
I'm Ryleigh.
I'm Dr. Stephen Kincaid. I'm a general surgeon at Trio Southridge Hospital. Has either one of you ever been in an operating room before? Have you ever been in a place like this?
I haven't.
Have you ever been in the hospital for anything?
Nope.
Yes.
And you've been in the hospital, is that right?
Mm-hmm.
What do you think about this operating room? Does it look kind of perplexing? Does it look complicated, or is it fairly simple?
It's complicated.
Yeah.
Complicated. Well, let's look at this equipment right here. What do you think that machine does?
Maybe it gives you your heart rate?
It measures your heart rate. When someone comes in, they would actually be lying on the table here. And as luck would have it, one of our medical students has volunteered to be a patient for a little while. So Quinn, let me have you lie down here for a minute.
Okay.
Okay, if she was in here for an operation, the first thing was she'd be on the table like this. She will not have had anything to eat or drink for at least 8 hours. We don't want to put anybody to sleep if they have food in their stomach. Do you have any idea why that might be? Yes.
It could probably puke it out.
You could puke it out, exactly. And if you're going to sleep and you vomit, there's a chance that some of that could go into your lungs, and that could be dangerous. That could give you pneumonia. So we try to always have the patient with nothing in their stomach when we put them to sleep. And then the anesthesiologist would be here at the head of the table, and they put on these heart leads to monitor the heartbeat. They have special instruments to monitor the breathing. She would have an IV, usually in her arm, and then medication is given through the IV and fluids are given. So while we're doing the operation, the anesthesiologist is very important because that's the doctor that keeps the patient alive. If the blood pressure would go down, then steps would be taken to correct that. Or if the respirations are too slow or too fast or something like that. So the anesthesia person is very, very critical. They're kind of like the co-pilot up here, and they're monitoring the patient the whole time. So what they would do when they come into the operating room, after she's asleep, there's drapes put all around her. So the only part that is exposed is the part we're going to operate on. And then the circulating nurse would come in, and this is a prep tray. They would pour this special solution that's antibacterial. Okay, do you know what antibacterial means? Yeah.
It has no bacteria in it?
Yeah, and it actually kills any bacteria. See, everybody has bacteria on their skin. Okay, bacteria are everywhere. And so we try to do this in a sterile manner. We don't want an infection after we do the operation. So the circulating nurse would take one of these trays and fill it with liquid, and then they go like this and scrub all the skin where we're going to do the operation. And then we would actually, she would be draped like this, so we have these sterile towels all around, and we'd have these other drapes, and then we would just operate on the one place there. And while we're doing the operation, she would have no knowledge whatsoever. She's sound asleep. She would have no memory or anything like that of what's going on. You can see all of these clamps and instruments and everything. This is just a routine amount of tools that we would do for a very simple case. Okay, sometimes if it's a real complicated case, we might have 2 or 3 tables full of instruments. And some of them are small or simple things like this, and some of them are very technologically advanced instruments, okay? And we always have at least one scrub nurse who's gowned and gloved and sterile, and she helps with the operation, and she passes instruments to us. And we always have at least one circulating nurse who isn't scrubbed at the table, but she's keeping an eye on everything in the operating room. She's the sort of another co-pilot. And it's very, very important because she will keep track. She will watch how much blood is being used. She'll watch all the other things and keep an eye on things. And if she sees something that looks like it could be trouble, she will tell me right away. So we can correct things like that. Now, have either one of you ever heard of laparoscopy? You have any idea what that is? Okay, that's with certain operations. If Quinn needed her gallbladder taken out, in the old days what we used to do is we'd always make an incision across like this. We'd make an incision about that big. The last 15 or 20 years we've been doing most of those types of surgery with a laparoscope. And we make little bitty incisions. And we don't actually open up the whole abdomen, but we make little bitty incisions and then we watch. It's like watching on TV. Let me show you. This is a special camera, and we'll turn this thing on. And so if we made this little bitty incision here, this would actually go inside the abdomen. And then you can see we would watch the operation up on the monitor like that. And so the surgeon and the assistant surgeon would have these tools inside, but our hands aren't in there. Our hands aren't in there, so we're watching things like up on that monitor up there or on this monitor here. Why do you think someone would want to have an operation like this?
It might reduce pain.
Very good, yeah. It's usually it's less painful. And a lot of times the person can go home from the hospital sooner after that. If you had to have an operation, what do you think, what would happen after we were done with the operation? What would happen next?
You'd have to wake them up.
Got to wake them up. You know, an operation is kind of like flying an airplane. The first part is you got to the airplane has to take off. And that's kind of what the anesthesiologist does, okay? The taking off in an airplane is like putting the patient to sleep. And then once the airplane is up where it needs to be, that's when the surgeon sort of takes over. And the surgeon does the operation. That's like taking the trip. But then what do you have to do when you get there?
Land.
You got to land the airplane. And landing the airplane is just like, sort of like waking up the patient. And that's a very important part. So the anesthesiologist puts the patient to sleep, keeps them stable during the operation, and then wakes them up. And if there's any problems at all, the operation might last longer. You know, we like to do things quickly, but we have to do it safely on things like that. Now, what do you suppose we would do if we had, say there was some little blood vessels in here that we had to repair or something? I'll show you a couple of tricks. We have these overhead lights that shine down on the patient. What do you suppose this is? What does this look like?
A light?
It's a real bright light. And so what I do, if we're having trouble seeing things very well, I put on this. And this attaches to a special power pack. And so this is a bright light. So, and see, it follows wherever I'm looking, it follows with where my eyes are. So that's one of the little tricks that I use that helps me out. So we use these little special advantages. Now these are some funny looking glasses. Have you ever seen anything that looks like this?
No.
Let me put them on Quinn, see how funny she looks. What do you suppose those are?
Microscopes.
Magnifying glasses?
Exactly, they're like microscopes, or we actually call them telescopic glasses. But what we do with these is we put these things on. And this has 2.5 power, which makes things 2.5 times bigger than they normally would be. So if I was in a real difficult situation, I'd put these glasses on, I'd turn this light on, and I can get in here like this, and if I was having trouble seeing something real small in there, this makes it much easier to see. So what we do, we have a lot of these little tricks we do. We try to magnify everything we can. We try to make things as easy and safe when we're doing an operation as we can. Do you have any questions about anything that you've seen here?
How many surgeries have you done?
I would guess I've probably done about 20,000 operations, but each operation is a little bit different. You never assume anything. You have to approach each operation as something totally unique, and you don't ever say, just because I've done this 1,000 times, that I don't have to be careful, I don't have to be alert. You have to be very alert, very aware of everything, and you treat your 20,000th operation like you did your first one. That's the level of intensity that you have to have when you do that.
What's the longest operation you've ever done?
Longest operation, When I was a resident, I was on a neurosurgery service. And there was a high school principal that came in. We did some special studies, and we found he had a large brain tumor, but it was in a place that we could take it out. So I was the assistant surgeon on this one, and a neurosurgeon, a brain surgeon, actually did the operation, and I helped him do it. And we were scheduled for 7:30 in the morning. And by the time we got the patient on the table at 7:30 in the morning, and we got the entire brain tumor out, we finished the operation at midnight. So the actual operation was 15 hours. And during that period of time, there's no bathroom breaks, nobody's getting a sandwich or anything like that. The neurosurgeon stood on his feet, worked intently for 15 hours. And the patient went back to being the principal at one of the local high schools. He did very, very well, but that 15-hour operation was the longest one I'd ever been part of. So when you save someone like that, you feel really good. But when you lose someone in a situation, emotionally you feel very sad. You feel very down. And sometimes surgery is an emotional roller coaster. Sometimes things go very, very well, and it's really a great job, and sometimes things don't go so well. And emotionally, sometimes you have to kind of rejuvenate yourself because it can be a very sad situation. Well, Ethan, it's been great. I really appreciate you coming by. I hope this is something you may remember for a little while. And you asked some excellent questions and had some good answers, and Ryleigh, you did too. Excellent. I really appreciate you coming by.